exactly what's inside a ReLeaf standard. It's like this just plugs in. ReLeaf plugs into right here, like so. And then this can stay remaining here. Right on. Everybody, it's me, Hari, with ReLeaf Dental. Today we have a ReLeaf standard setup kit, and we're going to be doing some unboxing, kind of showing you guys exactly what you get in a ReLeaf standard setup kit. We're just going to open up this box, see what's inside of here. Alright, so when you first get a standard setup kit, you get the instructions. On the back of the instructions, it kind of goes over the troubleshooting if you have any issues with setting ReLeaf in the patient's cheek, dealing with a large oral cavity. It also talks about our contact and reorder information right there. On the front side, it talks about the patient's setup and patient use, how to put the leaves together and how to install it in your dental chair unit. And then right here is kind of walks over the sterilization, disposal, and storage of ReLeaf. But all the directions are on this one page right here. It's pretty simple to use. We wanted to keep it simple, so. And then with a standard setup kit, you get 100 leaves. As you can see, here are the leaves. They're all nicely organized in there. I think each bag is 50 leaves. So, and then if you zoom on here, you actually get the hardware. This hardware is actually fully autoclavable. So let's just open it up and kind of take a closer look at exactly what you see here. So you have this 8-inch piece right here with this U-bend. It's pretty nice. The tubing feels real soft. They say it's fully autoclavable. And then you open up this. This looks like the HVE end, where you stick it into the HVE. And then this is, they call it the quick disconnect adapter. And they advertise it on the directions that you can hang this actually on the dental chair, which we'll show you today. And then it looks like this just plugs in, like so. Plugs into the HVE. And then you have this right here, which ReLeaf plugs into right here. And we'll open up one of those leaves too. Pretty cool stuff. And then I think they give you this right here, which is an 8-inch piece of hose. Let's take a look at that. Yeah, so with this setup kit, you get an 8-inch piece of autoclavable hosing, and then you also get 4 of these guys, of these U-bends. And I think this is for actually transferring patients. So when you're done with a patient, you can simply just remove this end right here, put this through the autoclave, and then put another one on. And then you can wipe down the hose with a cavi wipe. If this gets dirty because this is near the patient too, you can take this out too and autoclave it too. So they give you an extra hose to do that. But they give you enough stuff here to kind of cycle through 8 patients a day. So it's pretty cool. So what we're going to do now is we're going to go in the dental clinic and actually plug this in and kind of go from there. Hey everybody, we're actually at the dental office. We're going to plug in ReLeaf and kind of see how everything works. So I got the box right here, put on some gloves. Nate, if you would come around over here. Oh. So let's see here. So here's that hose. We have the HVE adapter, and this just pretty much goes on any HVE unit valve right here. If you're in a hygiene chair and you guys haven't used this a lot, it helps sometimes to get your air water syringe and put a little bit of water in there. It'll help lube up that gasket and allow for ReLeaf to be able to slide in there nice and easy. So it's just going to go right there, like so. And then this can stay remaining here, right on the valve. And then we have this quick release right here, and you can see it if you zoom in right over here, Nate, that it just kind of goes nice and easy right in there. So for storage, you can kind of leave it right there on it, you know, when the patients are gone. So when you want to use it, you simply grab this and then 8-inch hose, and that U-bend just kind of goes right on that quick disconnect, and you're ready to go, and you're ready to put ReLeaf on. So let's just kind of put this right here real quick. So I have the leaf. So here's the leaf. It comes in 2 halves. It's pretty simple. So when you get it, all you have to do is there's a dovetail at the end. And what you want to do is you want to slide, I don't know if you can get in there, you want to slide that dovetail in. So you want to slide the dovetail together. Okay, very important you slide it. And then there's a little embossed area right here, and you just pretty much push that little guy through, and you're ready to go. And you can see that it suctions 280 degrees around the edge, but it also has this little hole right here in the center, and that's for calculus or any type of debris that you want to put in there to suction through. And this part always faces towards the patient's midline, so you simply just grab this hole faces outward, and boom, like that, you're ready to go. So it's really, really easy to set up ReLeaf. When you're done with the patient, you just simply dispose of the leaf, take one of these U-bends off, put this in the autoclave, wipe this down, and then grab another U-bend and place it right back on. One more thing I want to add too is ReLeaf is really, really strong. It's made to suction really, really well. So a lot of hygienists have commented on just starting off at quarter throttle, so right about here, and then if you need to, then you can increase the suction volume. Okay, so you don't want to start off all the way. You kind of want to feel the patient out, how comfortable they are, also kind of see how much water is being emitted from your ultrasonic, and you'll be surprised that at quarter throttle, it suctions quite well. So I'm going to actually do a suction cup test. So I'll put it at quarter throttle, and you can kind of see how well it suctions. So we got some water right here, and we're going to kind of go here, and we're going to put this leaf in here. So here's quarter throttle. So even at quarter throttle, it does a really good job. So this is obviously a lot more water than you guys are going to expect. Yeah, it takes about, once you get used to it, it takes about 10-15 seconds to set this up. Transferring through patients is really easy. Just simply take the U-bend off and put another one on. We recommend getting the standard setup kit. We also offer a basic setup kit for $29.99, which doesn't have the U-bends, but I recommend spending $114 and getting the standard setup kit. It'll get you everything you need to cycle through patients and make your workflow a lot better. So I appreciate you guys. Thank you for all the support, and stay tuned for our next video where we'll be actually placing this in the oral cavity and using an ultrasonic scaler and kind of seeing it in action. So have a great day, and talk to you guys later.